Hello everyone, I'm sure everyone has come across this term, which is Obsessive Compulsive Disorder, OCD. Most people think that OCD is all about being neat and clean. Some also mention that people with OCD are just being a bit fussy. But are all of this true? Let's take a deeper look into what OCD really means. Before I step into our content, let's watch this simulation video together on how a person with OCD will behave on a typical day.
A few moments later. Three hours later. Fifteen minutes later.
Alright, I am sure all of you have a clearer picture of what OCD is now. Next, let's dive into our main content. OCD is a psychological disorder characterized by recurrent cycles of obsessions and compulsions. Obsessions and compulsions in OCD are time-consuming, which usually take more than 1 hour a day and cause marked distress and anxiety in the patient, which may interfere with their daily routine. Their compulsive behavior is not due to them being fussy for pleasure, but is all because of their unwanted, distressing, and intrusive thoughts and feelings. OCD is a disorder where sufferers experience severe impact in their daily functioning. Among all psychiatric illnesses, OCD is categorized as the fourth most common psychiatric illness with lifetime prevalence of 1 to 3%. OCD is common not just in adults but also in children and adolescents. The difference between OCD in adults and in children is that children may not be able to realize the reason for their behavior or thoughts. Do you know that OCD usually develops during childhood or adolescence? According to the International OCD Foundation, OCD records higher prevalence in adults, as much as 1 in 100 adults than in adolescents, approximately 1 in 200 children. Generally, an OCD patient always has fear of contamination by disease, infection, or any unpleasant substance, so they keep washing hands to prevent contamination by germs. People with OCD who are primarily occupied with order and exactness tend to feel uncomfortable if not keeping every stuff in order. For example, they will ensure all the labels on the tins in the cupboard will face the same way and well organized. Besides that, OCD can also be associated with the fear of the possibility of harming themselves or other people intentionally when the obsessive thoughts come in. OCD patients are also afraid of harming themselves or others by mistake. The most common example is they will be afraid of setting a house on fire if they leave the stove on. These are all obsessions faced by OCD patients. OCD patients are all struggling on their own to control their behavior. Knowing that your own brain is lying to you while not being able to resist its commands can be agonizing. They always think that they can reduce their anxiety in some ways, but the obsession just keeps coming back repeatedly and causes them distress. Now, I'm sure you'll be wondering who will be at risk of getting OCD. In childhood OCD, males are at greater risk of developing OCD. However, after puberty, both males and females are at the same risk. Twin and family studies have shown that people with first-degree relatives such as parent, sibling, or child with OCD are at a higher risk for developing OCD themselves. The risk is higher if the first-degree relative is a child or teen. Not only that, elevated activity in the brain structure and infections can also put us at risk to get OCD. People are at the greatest risk of developing OCD at late adolescence, and the risk drops with age once entering early adulthood. If you ever experience any trauma, bullying, abuse in childhood, or any stressful events such as car accident before, you can be at risk of getting OCD too. So, we have looked through all the risk factors of OCD. But hey, do not worry too much if there is any risk factor that seems to fit your condition. OCD cannot be self-diagnosed just like that. You need to seek help from a psychiatrist to confirm whether it's OCD or not. Firstly, the psychiatrist will do history taking to ask for the symptoms and how long it has been. Patients' feeling, medical history, and development history will all be assessed to see if they have obsessive or compulsive behavior that are interfering with their quality of life. After that, the psychiatrist will conduct a mental state examination and use DSM-5 to further confirm the patient has OCD. There is a myth saying that OCD is not treatable. Well, that's definitely not true. Once diagnosis of OCD has been established, people suffering from OCD can undergo two kinds of treatments, which are psychotherapy and pharmacotherapy. The most common form of therapy that is used to treat OCD is cognitive behavioral therapy, CBT. CBT is a short-term, goal-oriented psychotherapy that helps individuals understand the connection between their thoughts and feelings, and how thoughts and feelings influence their behavior. It is widely used to help OCD patients to develop coping skills to deal with the obsession. The psychotherapy of choice for the treatment of OCD is exposure and response prevention, ERP, which is a form of CBT. In this type of treatment, patients are taught to face the fear that is caused by the related obsessions and to prevent them from performing the compulsive action in response to the situation. The patients may confront the fear situation in two ways, by either direct contact or through imaging encounters. There will be up to 25 sessions, either individually or by group, with each section lasting from 1 to 2 hours. The first-line pharmacologic treatment used to treat OCD is known as selective serotonin reuptake inhibitor, SSRI. These drugs are usually well tolerated and helpful for OCD patients. Medications can make it possible for someone to engage in the treatment. There are two types of SSRI for OCD treatment, which are FDA approved and non-FDA approved. The best form of treatment for OCD is the combination of both CBT and SSRI. Medication alone tends to provide less symptom relief to some people and may cause the symptoms to get worse once the medication is discontinued. In addition, psychotherapy and pharmacotherapy is a more effective way to respond to the obsessions and compulsions faced by OCD patients. However, the treatment varies from person to person by consulting with the psychiatrist. Some patients can start the psychotherapy alone first before initiating the pharmacotherapy treatment, or the other way around. The medication choice will depend on how well the patient responds to that particular medicine. Here are a few important things to take note for anyone who has OCD, or if you have any family members or friends diagnosed with OCD. OCD symptoms may persist for years or even decades. It's sad when you have OCD but people around you don't understand OCD. As family members or close friends, you have to educate yourself to understand more about OCD. Support from close friends are important for patients to fully cooperate with the treatment. The patient needs to complete the homework assigned by the therapist. It is also important to be aware of any possible adverse effects that arise from medication. To all OCD fighters out there, in order to recover, you must first believe that you can. Someday, you will get to live a better life just like other normal persons. It's okay to not be okay. Thank you!